listening to the LOZ Podcast Network.
Hello, everybody. Welcome back to the LOZ Podcast Network. I'm Ken Lawler, the host. You're either watching us in the LOZ app or you're listening to us on KRMS radio on Saturdays from 10 to 11 a.m. Every Saturday, we call it the Big Simulcast. We love our collaboration with KRMS. And by the way, did you realize you can go into the app and listen to any of the stations over there by just going to media and clicking on the station you want? You can listen in your car, your boat. You can listen while you walk, anything you want to do. But you can always find the LOZ Podcast Network anywhere in town. And you can always find Cira, Monnig with Lakeside Care Clinic with us because we have you on all the time because we love you. Welcome back to the LOZ Podcast Network, and we have something really cool to talk about today, don't we?
We do.
Listen, we always talk about, modalities and GLPs and peptides, and we love all that, and we know that everybody does that, but there's sometimes when we just need you and we need you quick.
Absolutely.
And we call that urgent care.
Yes, we do.
Did you guys realize that in town, there's limited resources for urgent care?
Yeah, there is. I think we have 3 urgent care locations within 60 to 90 mile radius. I mean, it's limited.
And, with the 250th birthday of America coming up and the 4th of July, and this town goes from, let's say 20 to 30,000 to 100 to 200,000 people. That's probably not enough.
No, not so much.
So we're out there because we want to let people know that if you have a problem and if you need urgent care services or acute, as you like to call it, and what is it? What is that? Tell us some of the things that people will come in for in urgent care.
So urgent care, a lot of it's lacerations. I mean, people work in, they slip on a boat.
Fish hooks. We do fish hook removals. But lacerations, we do suturing. People come in with UTIs, dehydration, poison ivy, tick bites, oddly enough. I mean, especially when you get into the tourist crowd, they're not comfortable with ticks and get a little freaked out. So they come in for that. Several different things, skin rashes, upper respiratory infections. If they're concerned about strep throat, list goes on. And, look, you come down here for vacation, you're here for maybe 3 days, maybe 5 days, and you have an issue, you want to get it taken care of quickly because the worst thing you can be doing is sitting in emergency room for 8 hours. Everybody in your group trying to get on with their lives and have fun. But you guys have come up with something that I think is really cool. And this is a 60-minute guarantee. Tell me what that means. A 60-minute guarantee. How do you even do that?
So you walk in the door, you get checked in, and no more than 60 minutes, hopefully more like 30 minutes, 30 minutes, you're seeing a provider.
Yeah. So you're in and you're talking to somebody within 60 minutes. And
absolutely.
All of us have sat in an emergency room for hours without seeing someone. We know what that's like. So it's amazing that you're going to be able to provide this for a 60-minute guarantee. And I don't even know if I want to tell them the price because I don't know how you're doing it, but for $149 to come in. I mean, that is, I've never been to an emergency room where I haven't walked out with a $500 bill.
Yeah, most of the time, even if you have insurance, your copay is still going to be several $100s. And then if you have labs or imaging or medications, that's more out of pocket. You're coming in, it's $149. You get seen in less than 60 minutes, and you're walking out with the medications and everything that you need. Most of our medications are anywhere from $5 to $10.
Wow.
So still way less than your copays.
Yeah, that's amazing. I think people think, well, if I go to Lakeside Care Clinic and I have insurance, they won't take my insurance. But in a lot of, like in this case, you're cheaper than copay.
Yeah.
So, that's amazing. And now let's just talk about this a little bit. So if they come in and they get something done and they want to continue with you, they can also sign up for any kind of other treatment you have, or they can get a membership too, right? So, I mean, there's a lot of people that I think that's the first time they see you is when they need you, right? Yeah. Like, I got a fish hook, I got to get taken out. The cool part is once you get in there and kind of see what's going on, then you have memberships for people that, they can join.
And memberships, to elaborate on that a little more, that's primary care. So a lot of people don't have a primary care provider wherever they may live. And we offer that to all of our patients as well. That's what the membership is. You pay a low membership fee monthly, but that guarantees you access after hours, weekends, whenever you need. We would be there and accessible. So
It's just amazing that you guys are doing that. And I think, in this town with such limited resources, you guys are becoming very popular for people, for a choice for them to go to. And you're so easy to get to, too. I mean, if you're in the middle of town off of KK and 54, I mean, it doesn't get more central than that, right?
That is the goal. Yes. I wanted to make it very easy for people to just get in, get out, and then get back to their family and having fun, not wasting an entire vacation or a day in an urgent care ER.
And I have to tell him a story because this really happened. But I have a friend who called me from the emergency room on a Saturday and said she'd been sitting there for 3 or 4 hours and nobody was going to come see her anytime soon. I called you. You met her on a Saturday, got her taken care of. She was in and out in like a half hour. And she had 20 people in town that were supposed to go on the boat, and she was able to get back out on the boat and enjoy that. That's a very, distinct story, but it just goes to show that you guys are you'll go above and beyond, and you try to get people back on their vacations or back out. No one needs to sit in a room for 6 to 8 hours to be seen.
No, I do not ever plan on that ever happening in our clinic. I will hire much more staff before that ever happens. And so, yeah, it's great. You're getting there, you're seen in less than 60 minutes, and you're back at it with your family and doing whatever it is that you guys want to do. And vacation's not ruined.
And the other things that people could come in for, like I know a lot of people, I have a lot of friends who I get my labs done with you, and we just did mine, and I'm gonna brag a little bit because my labs when we started were that great. The last one we did was great.
Really?
So in less than 7 months, you've taken me from being pretty high in some of these areas to right naturally in the middle. But I have friends who have not done lab work in years. And I ask them why they haven't done it. And they're like, it's just too much to go in and schedule. I got to schedule 6 months out. I got to then remember the schedule. Then I got to go and get the lab work done. And the lab work's a bunch of money. And I don't know what I'm doing. People can just come into you for lab work. So
Absolutely.
They walk in off the street. You will get lab work done for them, probably in the same 60 minutes or less, at least seen, right?
Oh, yeah.
And what is somebody going to pay for something like that if they want to just get lab work done?
So it would be an acute visit fee, the urgent care visit fee. And then the labs themselves, though, oh my goodness, we're talking maybe 30, no more than $50.
Wow.
Yeah. I mean, you're looking at most of the labs that you're paying hundreds and hundreds of dollars for after your insurance is paid. For those exact same labs, you're getting them for $30 from me.
Yeah, I was going to say, I think my labs, like just my copay was $200-$300.
Oh, yeah. There is I use this example all the time because I feel like it really stands out. But I had worked at an organization. I was an employee there, and I had drawn, or my son had labs done, and it was a respiratory panel of some sort looking at allergies and such. And after our insurance covered it, we paid $800. $800. That exact same lab I can get, and it's $50.
Wow. So really, anybody in town can go in. They don't have to be a current patient of yours. They don't have to be signed up with you. You can go by anytime, stop in during the day, get lab work done. You're going to walk out of there for $200. You're going to have your lab work done. And I got to tell you, you learn so much about what's going on with lab work. I didn't realize all the things you could figure out with just taking some good blood work.
Yeah, it really does tell you a lot. I'm a big lab person. I like to look at the data, the numbers, and it does tell a lot about several different things. And when those people, even if you're a person that just hasn't had lab work done, or if you're that person that just feels like crap and you're like, I don't even know where to begin, that's where I would say just come in for just a one-time acute visit fee and have a conversation with myself or Catherine, the other nurse practitioner. And we're going to help guide you and kind of evaluate things and help you determine what route, what pathway may be good for you.
And you guys did that with me. I mean, I came in and I had, my A1C was high, my bad cholesterol was high, my good cholesterol was low. I had all these things going on. And within 8 months of your guidance and doing what we did, my lab work came back great. And I'm just like, I thought it took years to get bad. I thought it took years to get better, but it really doesn't. If you kind of see what's going on, you guys can kind of zero in on the things we need and get in our body pretty quickly.
And I think also offering that guidance and explaining the whys behind what we're seeing gives you the incentive to do the work. I mean, you did all the hard work, the clean eating, the exercising, you did those things. And so we're just here to be a resource for people and to help guide them and get them healthy.
Yeah. And I just, I can speak from personal experience that just the atmosphere at Lakeside Care Clinic is, I don't want to say it's laid back because you guys are very professional and things are, but it's got a feeling of approachability that you don't find in the general medical profession, which I think is what that's what you're trying to build.
Oh, very much so. That is my heart and soul. I just want people to come in and wherever they are in life, I want them to be able to come in and feel comfortable to discuss whatever issues that they have going on. And we can discuss with them, do they prefer to be all natural? And are they okay? How do they feel about medications? And basically just find out where they are in their health journey and what their goals are and utilize us as a resource on how to get there.
Yeah. And I can tell you from personal experience, guys, it's amazing. Now you've got the 60-minute guarantee. So all of you guys that need to get to somewhere when you're down on vacation or you have a family member or somebody gets hurt or sick and you want to get in and out and not way down the whole weekend, you can do that at Lakeside Care Clinic. You can go there for just general lab work, or you might just go there and stop in and talk to them about their memberships and what's going on, because I think a lot of people they don't know where to start. And that's the hardest part. And sometimes you have to put an appointment 6 months out to find out where you start. They can really just kind of walk in with you guys, right? If they're okay with sitting,
Absolutely.
Yeah.
Absolutely. They can walk in. And I'm telling you, every one of our staff members know when they're hired, they know what my heart is with that place. And they have the same heart or they wouldn't be there. And so all of the people that are working there at all levels, I mean, they truly are just as patient-centered as I am. And truly just have the heart of helping people to get healthy. So they can call, the patients can call, they can walk in, they can ask questions. And honestly, our staff they're just wonderful to help them.
Well, thanks for everything you do for me and thanks for everything you do for everyone else. And guys, make sure you get to Lakeside Care Clinic. Don't forget 60-minute guarantee. If you have to get somewhere for urgent care, that's where you want to go. We will be following up with you later on next month. I know we have a lot of new things to talk about that you're involved with, but we wanted to really understand what was going on with the 60-minute guarantee because I didn't think you could do it, but it looks like you're going to do it. So, all right, everybody, that's another edition of the LOZ Podcast Network. We will be right back after these words.